What is the first thing that springs to mind when we think of an issue with the heart? It might be a dramatic movie scene in which someone is gripping their chest and falling to the ground, or it could be chest discomfort, shortness of breath, or something else entirely. On the other hand, the truth is rather different. In many cases, the indications of a troubled heart are far more delicate. In fact, they are so subtle that the majority of individuals entirely overlook them. It is possible that the harm has already been done by the time the traditional symptoms begin to manifest themselves. This is a disturbing reality. It's possible that you'll be startled if you believe that the only people who need be concerned about their heart health are those who lead bad lifestyles or are too old. Even if you are in good health, your heart may be a danger due to conditions that are not immediately apparent, such as persistent inflammation, persistent stress, or even poor dental hygiene. You may not even be aware of these conditions. If you are interested in learning more about the health of your heart, please give the video a like and subscribe to the channel so that you do not miss any of the next videos. Are you prepared to learn about these unexpected observations? Now, let's get started. Number 1. Snoring or sleep apnea. When you go to bed, does your partner remark that you snore loudly night after night? Even after a few hours of sleep, do you find that you are still exhausted? It is possible that you are suffering from sleep apnea, a disorder in which your breathing pauses periodically while you are sleeping, therefore depriving your body of oxygen. High blood pressure, arrhythmias, and even heart failure are all potential outcomes of this illness, which results in the heart having to work harder than it normally would. Discuss the various treatment options with your physician if you have any reason to believe that you may be suffering from it. Number 2. Feeling anxiety or angry for no reasons. A significant number of individuals are not aware of the fact that a sudden state of worry or panic might be associated with a cardiac condition. Your heart may be having difficulties keeping a normal beat if you have feelings of anxiety for no apparent cause, and if these feelings are followed by palpitations, perspiration, or shortness of breath. During periods of repose or in the absence of a discernible trigger, this phenomena may manifest itself. In the moments leading up to more significant cardiac events, individuals who have heart difficulties may sometimes suffer periods of acute anxiety or a sensation of terror that is not justified. If you get anxiety or panic episodes that you cannot explain, and there is no evident explanation for them, you should see a doctor to rule out the possibility that you have a cardiovascular condition. Number 3. Pain in the calf or swelling. If you have ever suffered frequent cramps, felt your calves uncomfortable, or observed swelling after walking, you may have encountered these symptoms. It's possible that you believe it's because of your age, dehydration, or even a small bit of exhaustion. For all intents and purposes, however, that may be a considerably more significant indication. Plaque accumulation can cause the arteries to become restricted or obstructed, which is a condition known as peripheral arterial disease, PAD. This symptom may be an indication of PAD. It is a clear warning bell for the heart, raising the danger of heart attacks and strokes. This not only restricts blood flow to the legs, which causes discomfort and swelling, but it also causes the legs to become swollen and painful. If you experience these discomforts on a regular basis, you should not dismiss them. Exercising on a regular basis, maintaining a healthy diet, and giving up smoking are all ways to assist improve circulation. In addition, it is always recommended to seek the advice of a medical professional in order to undergo a comprehensive checkup. Number 4. Sudden and extreme weakness. Do you find that you are suddenly getting weak for no apparent reason? It is possible that you're approaching a major cardiac warning bell if the sensation is accompanied by other symptoms such as nausea, shortness of breath, or dizziness. It is possible for these symptoms to be brought on by poor blood circulation, which, in certain instances, may come before a heart attack. Under no circumstances should you consider the sudden appearance of significant fatigue. Number 5. Ankle and foot swelling. The presence of swelling in these regions may be an indication that the heart is not pumping blood effectively, which results in fluid retention. It is typical for persons who have heart failure to have this symptom, which is known as peripheral edema. It is important to get medical attention in order to determine whether or not your heart is functioning properly if you experience chronic swelling in your feet and ankles, particularly if it is accompanied by shortness of breath or weariness. Number 6. Bleeding gums or dental problems. Do you have gums that are bleeding or continuous foul breath? You could believe that it is simply a matter of poor dental hygiene, but it is possible that you are at a far higher risk for heart disease than you are aware of. Researchers have found a correlation between periodontitis, a chronic gum disease, and an increased risk of cardiovascular issues. It is possible for bacteria that are present in the mouth to enter the circulation, which has the potential to contribute to the creation of plaque in the arteries and to increase inflammation throughout the body. Are you interested in safeguarding your heart? It is important to practice proper dental hygiene, go to the dentist on a regular basis, and be on the lookout for any indications of inflammation in your mouth. Number 7. Pain in the back or jaw. This is not the only indication that there is an issue with the heart. Some people, particularly women, may experience discomfort in their jaw or back as an indication of a heart attack. The majority of the time, these symptoms is misdiagnosed with oral issues or difficulties with the muscles. Depending on the severity of the discomfort, it may seem like a tightness or pressure that is emanating from the chest. Contacting a medical professional is absolutely necessary if you encounter these symptoms in conjunction with feelings of nausea or perspiration. Number 8. Chronic wheezing or coughing. A chronic cough may indicate heart failure, particularly if it is accompanied by pink or white phlegm. This occurs due to an accumulation of fluid in the lungs caused by the heart's ineffective blood pumping. Lying down tends to make the cough worse, and it can also cause a tightness in the chest. According to some chronic heart failure patients, sitting is the only way to ease the suffocating feeling they have when they wake up in the middle of the night. See a doctor for an examination if your chronic cough does not go away with standard remedies. It would be irresponsible of you to disregard any of these symptoms that you or someone you care about may be experiencing. Have a conversation with your physician and find ways to enhance your way of life. The next thing I want to know is whether or not you have ever experienced any peculiar symptoms that caused you to be concerned about your health. Let us know in the comments section. If you found this video to be useful, please give it a like, subscribe to the channel, and enable alerts so that you may receive further ideas on health. Always keep in mind that prevention is always the best treatment. Always remember to take care of your heart, since it is responsible for each and every moment of your life.